A local mother is really facing a heartbreaking choice. Abandon one child with a severe mental health disorder or bring him home and put the whole family in danger.
The hospital is saying he needs to leave. If I take my son home, I lose my other son to DSS because I'm putting him in a dangerous situation.
Anchor Brittany Johnson has been following this story for months.
She discovered that even after the mother sued the state over her son's treatment, he's still not getting the help he needs.
There are words.
Like most parents, Catherine Noto hangs her kids' artwork on the wall. But this piece represents the years of abuse and neglect her two sons endured.
Fight, scared, help me.
Before she adopted them.
They know that God was always with them and watching over them.
But the trauma left her youngest son with a severe attachment disorder that sends him into violent rages. The latest happened December 9th.
He took a frame off the wall and stomped on it so that he could get the shards of glass. So he had it to his wrist and he picked up another one to come at me with.
Her son came to Atrium's Behavioral Health Center. They determined he was a threat to himself and to others, so much so that he needed to be in a residential facility. But social workers couldn't find a placement for him in state that his insurance would cover. And days later, when it seemed like he was improving, they told her he would be discharged.
I told them that I would not be coming to get him, that it was too dangerous and for his safety and the safety of my other child and myself, so we needed to keep looking for a bed.
It's been 7 weeks and the 13-year-old is still there. Noto says he's being monitored but is not receiving any treatment and doesn't have a bed but sleeps on an ottoman. She's afraid of being arrested, like one South Carolina mother was last November. This police report shows a woman was charged with neglect after refusing to pick up her daughter when a Spartanburg hospital discharged her after a violent incident. Advocates say sometimes to get the help needed for children like Catherine Noto's son, parents actually have to sign them back over to DSS.
I refuse to accept that. Why should I have to give up my son to get him mental health help?
The services that
Therapist Sally Gordon has spent the past 30 years working with foster and adopted children.
They started out with, all the best intentions, the right reasons to adopt these children.
Gordon says there aren't enough providers to treat the most severe cases, and it isn't easy.
Where would you rate your sleep?
She showed us how she retrains traumatized children's brains with neurofeedback.
Calm me down.
She says many of her clients do improve, but one of the big problems, because of low rates, many providers who offer specialized therapies like this one don't take Medicaid, which most foster kids and adopted children rely on.
Do you find that they're getting the type of therapy they need while they're in foster care?
Not really, no.
More than 11,000 children in North Carolina are in foster care. Advocates say the majority need mental health treatment, but a number of parents have told Channel 9 their children did not receive appropriate treatment in DSS custody.
Do you think children are suffering?
Absolutely.
Catherine Noto believes if her son had been helped years ago, she wouldn't be in this tough spot.
All I want to do is help my kid.
And he wouldn't be sitting in a hospital. Brittany Johnson, Channel 9 Eyewitness News.
And Brittany tried contacting DSS but did not hear back. Atrium wouldn't comment on this family's predicament but said they are seeing more desperate parents leaving children at emergency rooms. Cardinal, which handles mental health care for children with Medicaid, emailed a statement saying in part, "We have a robust and diverse network of providers, and that in the rare instance that an out-of-state facility can better serve a family's needs, we will pursue this option." And just 2 hours ago, we got word that after 7 weeks, a spot has been found for Catherine Noto's son at a Rock Hill facility.